I want to welcome to the show my dear friend, Dr. Ann Silverman. Ann, welcome.
Thanks, Tony. It's great to be here.
Ann, I made a very bold statement, and I said that up to 50 to 60% of all upper respiratory bronchitis pneumonia is really not correctly diagnosed. That's a bold statement, and it's very peculiar, I think, to me, certainly, when I first heard that claim, and I think to almost everyone in the audience. Why would somebody who studies the bowels and the throat, why would you have any expertise or any knowledge at all would affect upper respiratory infections?
Well, based on my observations and clinical studies, it's known that when people have acid that fluxes from the stomach into the upper airways, this can cause irritation that can lead to bronchitis, pneumonia. It can go all the way up to the nasal passages, cause sinusitis. That's inflammation of the sinuses. It can also irritate the ears. And I can recall one day walking through the emergency room in Henry Ford and seeing you there sitting with your daughter. And I said, "Hey, Tony, what you doing here?" And you said, "My daughter, she's having another asthma attack. She can't breathe." And I looked at this little girl and I said, "Tony, I know what the problem is. You're always telling me about how she's going to soccer practice. She goes to school. She goes to soccer practice. She comes home at 8 o'clock at night, and then you feed her. And then she goes to bed. So what happens? When you eat, you make acid. When you're standing up, the acid stays in the stomach. When you lay down, the acid goes all the way up the esophagus and into the airways."
So you're saying that the acidic content of what's in your stomach is actually, but how does it get into the lungs? I don't quite understand. I thought it was all contained within the digestive tract. How is it actually permeating or getting into the lungs? I do understand it, but for the purpose of the audience, I'm asking you.
Well, what happens is whenever you eat, you make acid. The stomach has two functions, and the most important one is to break down the food, and it does this by secreting hydrochloric acid. And if you're standing up, the acid is going to stay at the base of the stomach. But when you lay down, the acid goes up into the esophagus, up the food pipe, through the chest, all the way up to the airway. It can cause sore throat. It can cause problems with your teeth, loss of the enamel in the teeth. And this has to do with the change in position at night. Another condition that predisposes to acid reflux is obesity. And in Michigan, we rank very high in terms of people being overweight. Anything that will put pressure on the stomach, either laying down, putting pressure on the stomach, being overweight, will predispose to having the acid, which is normally contained in the stomach, go up into the esophagus. And once it damages that valve, which we call the junction between the stomach and the esophagus, when that valve becomes irritated, it doesn't work properly, and then you get more acid reflux. What happens is then the patient goes to the doctor. They have upper airway problems. The doctor listens to their lung and says they hear the patient wheezing, and that's because the airway is tightening up because of the irritation. They give the patient steroids, prednisone, Solumedrol,
sulfate,
inhalers that have steroids. Patient takes them. They get better because it's an irritation. And
I know a lot of Z-Paks, and azithromycin is also sometimes prescribed, or no?
Well, azithromycin or Z-Pak is an antibiotic, and so if you have an infection which can result from irritation, you can get a Z-Pak.
Well, I've noticed that a lot of people just customarily they just do Z-Paks. I need a Z-Pak, I need a Z-Pak. So they're constantly reinfecting themselves because of their late night eating. No, it's not really just late night eating. It's actually not the time you eat. It's actually the duration of the time that you spend in a prone position or in an upright position. So in other words, late night eating is not the problem. It's how long do you wait after you ingest foods. What would you tell people is the shortest time period they should wait before they actually lay down?
You should wait at least 3 hours after you eat before you lay down. and some things take longer to empty than others. And people who have conditions such as diabetes may have delay in stomach emptying. So it's very important to stay upright. And if you can't stay upright for 3 hours, you might want to get a wedge to put on your bed so that you're laying sitting up.
So an acid reflux is a brutal disease. I mean, I actually suffer from it. As you know, I woke up one night and I couldn't breathe. My airways were completely shut, closed. And I'd said to you that all I did was eat, a healthy shake. I used to drink a healthy shake so I'd supposedly have energy in the morning workout. It's not what you eat, it's that you ate it all. Is that true?
It's eating late and then laying down, and that's the most important thing. A lot of people say, I just eat a cookie or I eat an orange before I go to bed. But the stomach doesn't know what you ate. You're going to make acid, and that acid is going to get up into the esophagus when you lay down. Now,
Ann, if I'm just going to say this for the sake of you saying it, how soon after a person decides to not feed their child late, how soon can they expect their child could basically see symptom-free, no more infections? How long do you think it would take before they notice a difference?
Well, this can happen right away. I think it's important to start tonight. If you just gave a snack to your child, you should make sure that they sleep sitting up. You can put some pillows under them, and within a few days you'll notice almost complete improvement.
Now, Ann, I noticed that you had mentioned to me one time that you were told that the advanced condition of acid reflux, which is the onset of Barrett disease, which is a precursor to esophageal cancer. By the way, esophageal cancer, I was looking at St. Joseph's, I think it was St. Joseph's Mercy website. They say that esophageal cancer is the fastest growing cancer in the history of cancers. It says here 13,500 Americans get esophageal cancer with 12,500 deaths. That is a more than 95% mortality rate, and further research showed that when the esophageal cancer is actually diagnosed, it almost always exhibits itself in a stage 3 or stage 4, which is 98.5% mortality rate within a year. That's a brutal statistic.
That's right. And if you look at esophageal cancer, it's more common in white men. And I've come to understand why that is. Men, they think that having heartburn is the way they're supposed to feel. So they go for years and years with heartburn. And what happens when the acid, when it gets into the esophagus has a lining just like your skin.
Dry.
Imagine.
It's dry.
Well, it's exactly the same. Under the microscope,
okay.
It looks like the skin. And what would happen if you pour acid on your skin? You get a burn.
Okay.
And so after years and years of this happening, the esophagus actually changes. The cells change. Any cell in the body has the potential to be like other cells, but they need the impetus to change. And so when this change occurs, it's more like the small intestinal lining. But that change causes the cells to divide incorrectly, leading to esophageal cancer. The first condition where it's changed is called Barrett's esophagus. And we know that Barrett's can lead to esophageal cancer. And the other problem is by the time you get Barrett's, you're no longer feeling the acid. So you're thinking, my heartburn's gone away.
So it's somewhat asymptomatic at that point. You're thinking you're cured, but you're actually, this new hybrid tissue is actually very vulnerable to irritation and for the onset of the cancer to come in. And as we know, once esophageal cancer hits, there's virtually not much we can do. Well,
as you mentioned, it's asymptomatic at that point. And then you don't present again until you can't swallow, just like what happened with your father. It was almost 2 years ago that I remember we were sitting at a concert, and you said to me, my father is having problems swallowing. And he went to his doctor, and the doctor ordered an ultrasound. And I looked at you, and I said, Tony, have him in my office Tuesday at 8 o'clock.
And that was the beginning of the worst 2-year episode of my life. It was a very surreal and unbelievable experience to have one of your best friends come to you and tell you that your father is not going to make it. To my dad's legacy, I had Ann on. She's a brilliant researcher, a brilliant MD. We're going to take a quick commercial break, and when we come back, we're going to take